Hi everybody. We're coming to you from Afton today. We're here visiting the really cool people in Afton. But today we're going to do a pelvis slash hip. Okay. With all of our hip x-rays, we always do a AP pelvis. Okay. And then we do a lateral hip x-ray. Anyway, the projections are an AP of the entire pelvis. We want to include the entire bony pelvis, and then we do a frog leg lateral of the affected hip. Okay, we do these at 40 inches, primarily supine on the table, no tube angle. Central ray for the pelvis is 2 inches below the anterior superior iliac spine, or ASIS, or as is, whatever you want to say. It's 2 inches below that. Okay. For the frog leg, we're an inch medial to the ASIS and 3 inches below that point, which we'll go over in the positioning. Collimation, superior, you want to include the crest of the pelvis, right? Inferior, you want to try and include the lesser trochanters of the femur on both sides for the pelvis. Lateral, we just want to include the skin margins. Technical factors, we're going to shoot these around 70 kVp. Between 50 and 30 mass, depending on the size of the patient. Tips, we need to include the entire bony pelvis. We don't want to cut the crests off, and we don't want to cut too much of the femurs off. We want to include both greater trochanters. If you're cutting those off, you need to center a little bit better and take another picture. Okay. Make sure on the AP pelvis that the toes are inverted or turned in 15 to 20 degrees. That's going to allow the greater trochanters to flare out, and we can see them a little bit better. Okay. With the frog leg lateral, it's better if you can turn your collimator box to follow the femur down, and I'll show you that in a minute. Okay. Pelvis and hips they're fairly easy to do. Okay. And today we're on a traditional unit, but it's the same thing on the Paxis 100 unit. Okay. Anyway, for this, the traditional unit, you want to make sure that your cassette is lined up with your tube, and that your tube is detented. Okay. And you'll feel that detent right there. That just means that you're centered with your table and your upright bucky. Okay, so we've got a cassette in here. We just want to make sure that this is lined up so everything's centered, ready to go. Okay, all right, so first of all, we want to make sure that our patient is straight on the table. By the way, this is Emily. Kate's running the camera today. Okay, so Emily is very straight. Okay, she's on the table straight. That's what we want. We don't want our patient to be skiddywampus. Okay, because skiddywampus patients means skiddywampus x-rays. We don't want that. Okay, so we're going to open this to a 14 by 17. Sorry, the light in here is really, really dull. So 14 vertically and 17 horizontally. Okay, all right. So like we read before, here is the crest of the hip right here. And then the point of the hip, or the ASIS, is that bony prominence right there. Okay. And that's what we're looking at for a pelvis x-ray. So we want to go 2 inches below the pelvis, or below the ASIS. It's actually between the pubic symphysis and the ASIS. So approximately 2 inches below the ASIS. Or at the level of the greater trochanter, which you can feel for, but you don't need to. Especially on Emily, you can feel that ASIS really well. Let's go 2 inches below that. And right there, okay? And we're going to have centering point 2 inches below the ASIS and the mid-sagittal plane. Okay, we've got our collimator open to 14 by 17. We just want to fill the top of the hip here, or the pelvis. We want to make sure there's light above that, so you're going to catch all the way from the crest all the way down to the lesser trochanter, or the inside of the femur. Okay, now for the AP pelvis, we want to make sure that we're turning the toes in 15 to 20 degrees. That's going to roll the greater trochanters out. A little tip for you: if you ever get a patient in here and they cannot do that, and their leg is kind of just kind of hanging off to the side, that usually means that they have a broken hip. Okay? If they're relaxed like that, don't try and invert their toes. Okay? If it gives them any pain or anything, just don't do it. For most people, we're just going to invert the toes. Okay? Just like that. All right. Then we're going to grab our marker. We're actually going to either put it right there in the light or right here in the light. Okay? And you'll be good to go. So we're centered mid-sagittally, 2 inches below the ACES, and that is your AP pelvis. Okay? Make sure you turn those toes in. And then we're going to do a frog leg lateral. Okay? The centering for a frog leg lateral is a little bit different. Okay? We're actually going to fill for Emily's ACES again. And our central ray is going to go 1 inch medially to the ACES. Okay, so 1 inch medially. So we got 1 inch there, and then 3 inches below the ACES. So 1 inch medial, 3 inches down. Okay, that's your centering point. So I like to center my patients before I put them in a lateral. That way you're ready to go. Okay, so we're just going to have Emily bend her knee, and I usually put their foot close to the other leg, and then we'll just roll our leg out. Okay, that's why they call it a frog leg. Okay, now we're going to turn our collimator box so it follows the femur up. Okay, so we went from this, and our central ray is going down like this. We turn our collimator box to follow the femur up this way. Okay, that's going to straighten that picture up on your image, okay, or on the screen. So we're going to catch the entire acetabulum along with the head of the femur as it fits into the acetabulum, okay, and we're open to approximately a 10 by 12 at this point. Just remember to follow the femur down. Okay, your centering point is 1 inch inferior to the ACES and 3 inches below that point. Okay, once you're to that point, just go ahead and roll their leg out. Turn your collimator box to follow the femur up. And then we're going to mark it right here with an R. Okay, and we'll be good to go. We're going to shoot these at 70, between 20 and 30, depending on the size of the patient. On somebody like Emily, I'd probably shoot it at like 15 mass. Okay, because she's a skinny winnie. So anyway, thanks for stopping by today. I appreciate you guys watching this. I hope you find these helpful. Keep watching them. Okay. A couple questions for the day is where are we today, and who is my model? Easy questions. Anyway, thanks. Have a good day.